Can you hear me?
Yes, sir.
Okay. Your slide हो? Your slide मा थियो?
सर अहिले त स्लाइड नै आइरहेको छैन।
अहिले आयो? Screen share भयो? Hello?
सर हुँदैछ।
भयो?
Why, sir?
यो स्लाइडमा थियो कि यो भन्दा पछिल्लो?
सर यो पछिको।
यो स्लाइड हो कि अर्को?
सर नेक्स्ट स्लाइड हजुर सर यहाँ।
यो स्लाइड हो?
Yes, sir.
So thalassemia might present with a case of iron deficiency anemia. So you have to keep in diagnosis, differential diagnosis of thalassemia, anemia of chronic disease, and lead poisoning. यसमा सबैमा चाहिँ microcytic hyperchromic anemia हुन्छ. So तिम्रो टेल भन्ने फर्मुला हुन्छ. T बाट thalassemia भयो, anemia of chronic disease भयो, A बाट अर्को चाहिँ iron deficiency anemia, अर्को चाहिँ lead poisoning. So टेल भनेर चाहिँ these are the causes of iron deficiency, microcytic hyperchromic anemia. Diagnosis मा चाहिँ CBC गर्नु पर्यो हैन, hematocrit लेभलहरु गर्नु पर्यो. If there is low MCV, low MCH, MCHC levelहरु चाहिँ डिक्रिज हुन्छ है. So reticulocyte can be normal or elevated. So peripheral blood smear मा चाहिँ microcytic hyperchromic RBC with anisocytosis or anisopoikilocytosis so with increased RBC distribution with there might be thrombocytosis as well in case of iron deficiency anemia. So one should look for stool examination for parasites, stool for upper blood to exclude blood loss from gastrointestinal tract, or Menzel's index one. So you have to know whether it's thalassemia or iron deficiency anemia. So one should look for MCV divided by RBC count. So in case of iron deficiency anemia, RBC and MCV do decrease. So RBC level is more decreased, very common. So it's more than 13, whereas in thalassemia, MCV level is decreased, so it's less than 13. So also iron profile is very must in case of iron deficiency anemia to diagnose a case of iron deficiency anemia. So in iron deficiency anemia, the iron profile is very low except total iron binding capacity, which is high, right? So it should be more than 350 microgram per deciliter. So whereas serum ferritin, serum iron, and transferrin saturation are low, right? So iron profile, you should look for whether thalassemia okay, iron deficiency anemia. So iron deficiency anemia TIBC को level high हुन्छ अनि चाहिँ अरु चाहिँ अरु parameters such as serum ferritin, serum iron हैन अनि अर्को transferrin saturation हरु चाहिँ decrease हुन्छ. Whereas in other condition हैन तिम्रो चाहिँ chronic condition हरु छ नि ferritin level हरु high हरु हुन्छ हैन. In case of तिम्रो thalassemia TIBC हरु high हुँदैन है. So serum ferritin can be increased as well, and serum iron low name, so the serum ferritin might be increased, the TIBC won't be high, right? So in case of iron deficiency anemia, the TIBC is high as well as serum ferritin and serum iron, and transferrin saturation is low. So now coming to treatment, so amount of iron-rich food is increased. Avoid food that interferes with iron absorption. Oral administration of simple ferrous sulfate or gluconate or fumarate. Most often we have syrups in ferrous sulfate. Provides inexpensive and effective therapy. So there should be no evidence that the addition of any trace metal, vitamin, or other hematinic substance significantly increases the response to simple ferrous salts. So daily doses. So dose of iron supplements, that's ferrous sulfate, is 3 to 6 mg per kg of elemental iron in 3 divided doses. So with higher doses used in more severe cases with maximum doses of 150 to 200 mg per day. So, or if you start with oral iron therapy and there is a failures, and you should relook for the diagnosis, whether the diagnosis is correct or not. The patient might be a case of thalassemia or thalassemia. There might be disorder in case of absorption, such as in celiac disease, malabsorption, gastrectomy, or rapid iron loss, usually from GI tract. So in those cases, or in case of ongoing blood loss, or if the patient cannot tolerate oral iron or malabsorption, then we can use parenteral iron preparations such as iron sucrose, ferric gluconate, iron dextran, which is diluted in 150 ml of NS and given infusion over 30 to 90 minutes. So iron requirement should be calculated. So 2.3 times the target hemoglobin minus current hemoglobin times the body weight plus 500 to 1000 mg that are the iron stores. So right, so that is the total iron requirement. So blood transfusion should be done in case of acute severe hemorrhage. So if there is severe anemia leading to congestive heart failure, the hemoglobin level less than 4 grams per deciliter, so blood transfusions should be done in those cases. Whereas now talking about the response to iron therapy. So after 12 to 24 hours, the replacement of iron, intracellular iron enzymes, decrease irritability and increase appetite. So after you give iron for 12 to 24 hours, after that 36 to 48 hours, the initial bone marrow response with erythroid hyperplasia. 48 to 70 hours, there might be reticulocytosis and peaking at 5 to 7 days, and after 4 to 30 days there might be increase in hemoglobin level. So this 1 month गर्दाखेरि बल्ल 1 gram per deciliter बढ्छ है. अनि whereas if you give blood transfusion दियो हैन, so if you give like 15 ml per kg ले दियो भने हैन, किनभने हाम्रो 1 pint त दिनु मिल्दैन हैन, so you have to calculate according to the weight हैन. अब के गरी 15 mg per kg ले दियो भने अब usually 1 pint ले चाहिँ तिम्रो 1 gram per deciliter बढ्छ भन्छ in case of adults, whereas in case of pediatrics हैन हामीले के गरे 15 mg per 15 ml per kg ले दियो भने blood त्यो चाहिँ 3 to 5% ले चाहिँ hemoglobin बढ्न सक्छ है त. Whereas in case of iron therapy, oral iron supplementation गर्दाखेरि चाहिँ तिम्रो चाहिँ 1 month लाग्छ. 1 gram per deciliter बढ्न चाहिँ about 1 month लाग्छ है त. So now coming to prevention. So excessive intake of milk, particularly cow's milk, should be limited. So less than 20 to 24 hours per day. So breastfeeding should be encouraged. Deworming should be done. So word food programs serve the underprivileged and food deficit school children studying in 10 district of Midwest and far West Nepal, fortified with iron. Iron supplementation food. Infant who are not breastfeed should receive iron fortified formula. Right? So these are the preventive measures in case of iron deficiency anemia. So we have another class in case in anemia. So we'll be talking about megaloblastic anemia. So do you have any questions regarding anemia, iron deficiency anemia and anemia as such? Keisha, can you hear me?
Yes, sir.
केही सोध्नु छ तिमीहरुको छ नि
Fine, sir.
के रे एनिमिया भयो हैन एनिमिया तिम्रो हेमोग्लोबिनोप्याथीजहरु भनेर छ कि छैन क्लास सेपरेट क्लास
छैन सर
त्यही त यो एनिमिया 1 and 2 राखेको छ हैन यसमा नि अब हेमोग्लोबिनोप्याथीजहरु कभर गर्नुपर्ने हो कि ल आई लेट यु नो है किनभने अब हेमोग्लोबिनोप्याथीज पनि इम्पोर्टेन्ट हुन्छ तिमीहरुको थ्यालेसेमिया सिकल सेल एनिमिया भइसक्यो
छैन सर भकै छैन
छैन हैन सो आज त अप्रोच टु एनिमिया मात्रै भयो विथ तिम्रो मोस्ट कमन चाहिँ आइरन डेफिसिएन्सी एनिमियाहरुको कुरा भएछ हैन अब तिमीहरुलाई अब इम्पोर्टेन्ट त अब अरु पनि छ अब हेमोग्लोबिनोप्याथीजहरु छ हैन हेमोलाइटिक एनिमियाहरु छ अब यो यिनीहरु पनि डिस्कस गर्नुपर्ने हुन्छ ल अर्को क्लासमा डिस्कस गरौँ ल है त थ्यांक यू
Thank you, sir.
Thank you, sir. Thank you, sir.
Sir.